بسم الله الرحمن الرحيم. أبنائي الأعزاء، نكمل وياكم المحاضرة الأولى وراح ناخذ الجزء الثاني من المحاضرة. نبدي بالبوست pre-operative prophylaxis against aspiration pneumonia. We use antacid given as a single dose 3 ml approximately 15 to 30 minutes before anesthesia, and has two major advantages: rapid onset of activity, effective on the fluid already present in the stomach. The major disadvantages are short acting and not last along the surgical procedure, may cause emesis, incomplete mixing in the stomach, added fluid volume to the stomach. Acidity, as we know, may cause aspiration pneumonia. So we treat it by the first is antacid. Second one is by gastric motility stimulant, prokinetic agent like metachlorbromide, placid, decrease the gastric volume by promoting gastric empty. Orally should be given 1 hour before anesthesia. When given IV, should be slowly 15 to 30 minutes before anesthesia. H2 receptor blockers decrease gastric acidity and volume by decreased gastric acid secretion. When given orally, the effect is after 1 to 3 hours. When given IV, the effect is after 30 to 60 minutes. After IV routes, the cimetidine dose should be repeated in 6 hours. This is related to half-life time of cimetidine, whereas the therapeutic concentration of ranitidine and famotidine persist for 8 and 12 hours respectively. Okay? Proton pump inhibitors act as the final site of the gastric acid secretion, as you know from the mechanism of action. Making these agents is very effective in suppressing the acid secretion. Okay, this is against aspiration and pneumonia, preoperative preparation. Now preoperative bowel preparation. شلون احضر الباول to the operation. We have two types of operation: elective and emergency. elective العمليات الباردة. We have mechanical preparation by one or both of two methods. In mechanical, whole gut lavage by an electrolyte solution, mannitol 10% or polyethylene glycol 1 day before surgery. The second mechanical preparation by standard mechanical cleansing, which utilize dietary restriction, catheter or enema 1 to 2 days before surgery. Either lavage or mechanical. The second one is antibiotic preparation of the bowel. We have oral regimes, an aminoglycoside with erythromycin base, an aminoglycoside with metronidazole مع flagyl. We have parenteral regime, cefoxitin IV before anesthesia. Combination of parenteral and oral antibiotics show low incidence of infection. Okay, we prefer the combination. Emergency colon preparation. Intraoperative lavage performed by introducing of saline in the colon through بالون catheter. يعني داخل العملية أنا شو أسوي؟ أحضر الكولون بواسطة saline. Parenteral antibiotic, they should be given IV shortly before the operation and continue for 1 to 7 days post-operatively. Okay, now the other subject is the control of pain. The guidelines for success give regular doses rather than an as required basis. يعني أعطي بانتظام، يعني مثلا 3 مرات باليوم، مرتين، اوكي، احسن مما اعطيها عند الحاجة، و choose the best route. We have non-narcotic or simple analgesia like paracetamol, 0.5 to 1 gram each 4 hours per dose, but not exceed 4 grams daily because of liver impairment, and there is a caution in liver impairment. NSAID like ibuprofen 400 milligram each 8 hours per dose, or diclofenac 50 milligram each 8 hours per dose, or 100 milligram per rectum or IM. These are good for musculoskeletal pain and renal or biliary colic. Okay. Contraindication in peptic ulcer, clotting disorders, anticoagulant, aspirin is contraindicated in children due to Ray's syndrome. Caution in asthma, renal or hepatic impairment, pregnancy, and elderly. Opioid drug for severe pain. Morphine 10 to 15 milligram 2 to 4 hours IV or IM, or dimorphine 5 to 10 milligram 2 to 4 hours per dose subcutaneously or slow IV. Side effect: nausea, respiratory depression, constipation, cough suppression, urinary retention, and sedation. So, not used in hepatic failure or head injury, because the conscious is disturbed. There is a disturbed consciousness, so we not give opioid. Dependency is rarely a problem. يعني أنا ما أخاف من إنه خاف يصير عنده تعود أو غيرها. Naloxone can reverse the effect of excess opioid. If we give more dose, we can reverse the action by naloxone. Other is epidural analgesia. Opioid and anesthetic are given into the epidural space by infusion or as a balloon, as a bolus doses. Adjuvant treatment like anticonvulsant, antidepressant, gabapentin, or steroid for neuropathic pain. Antispasmodic like hyoscine butyl bromide. Okay, we go to another subject which is the nausea and vomiting. They affect 75% of patients, and nausea and vomiting predisposes to bleeding, incisional hernia, and aspiration pneumonia, and low absorption of oral medication. poor nutrition and low potassium. So we must treat nausea and vomiting. Causes of nausea and vomiting: prolonged surgery, anesthetic agent, post-operative ileus, bowel obstruction, constipation, gastric reflux, peptic ulcer or bleeding, medication, and hyponatremia. Classification of antiemetic: we have anti-dopaminergic agent act against opioid nausea and vomiting. They may cause sedation, extrapyramidal side effect like prochlorperazine stimetyl IM or metachlorbromide placebo. Antihistamines cause sedation, tachycardia, hypotension with IV injection like cyclazine. Anticholinergics used against opioid emesis may cause sedation, dry mouth, confusion. Example, hyoscine, which is scopolamine. Antiserotonin has a lower side effect like ondansetron and granisterone. The other subject is constipation, caused by lack of privacy, immobility, pain from wound or anal fissure, dehydration, poor nutrition, low dietary fiber, opiates, iron supplements, and spinal anesthesia. All these may cause constipation. Treated by bulking agent, fibogel, 1 sachet per ounce by daily, 2 times daily. Stool softener like sodium docosate, 30 to 60 milligram once daily per ounce. Osmotic agent lactulose, 5 to 10 ml by times daily, 2 times daily. Stimulants, example Sina, 1 tablet by times daily per ounce or besacodial per ounce. ثانك يو. هاي هسه عندكم المحاضرة الأولى كملت، تقروها تركزوا لي على الوورد، وإن شاء الله أتمنى لكم التوفيق والنجاح الدائم.